You're watching Coping with COVID-19 with Chris Manners. Today's special guest is Dr. Darpun Sachdev.
Hi, I'm Chris Manners and you're watching Coping with COVID-19. Today my guest is Dr. Darpun Sachdev. She's an infectious disease specialist and leading the COVID case investigation and contact tracing team for the San Francisco Department of Public Health. She's here today to talk about the city's contact tracing program and how we're using it to slow the spread of the virus. Dr. Sachdev, welcome to the show.
Thank you so much for having me.
Can we begin by talking about when the city's contact tracing program began and what its purpose is?
Sure. So we started case investigating and contact tracing on the first day that we had a case here in San Francisco. So that was March 5th of this year. The purpose of our program is to provide comprehensive services to people who are exposed to and diagnosed with COVID. So this includes that anyone who's newly diagnosed gets a phone call from our trained health professionals in which we talk more about their diagnosis, make sure that they have accurate information. We then go into understanding a little bit more about their symptoms and trying to better understand when they first may have become infectious to others. As part of that, we will then talk a little bit more about any places they may have visited for an extended period of time and people that they were in contact with. We then seek to better understand the individuals that they were in touch with by collecting names and phone numbers, so that then we can reach out to those individuals and make sure that they have the information they need in order to quarantine and get access to immediate testing for COVID.
How does the program actually work? How many people are currently acting as contact tracers, and what exactly do they do?
So we have a team of nearly 100 people with the city who have been activated to provide comprehensive case investigation and contact tracing services for San Franciscans. So this team is highly trained in being able to provide everyone diagnosed with COVID with information about what this means to them and make sure that they know the resources that are available to them so that they can safely isolate. This team then also works with several social workers as well as other city departments in order to make sure that every individual has access to wraparound services in order to complete their isolation and quarantine. In general, we have staff that represents all diverse backgrounds in San Francisco and are also able to provide linguistically appropriate services to ensure that we're able to meet the needs of the people who are being diagnosed.
That's great. When we ran a huge testing program in the Mission District, what role did contact tracing play in that effort? Was there anything notable?
So since the beginning of this epidemic, San Francisco Department of Public Health has been closely tracking who has been disproportionately affected by COVID-19. We partnered with UCSF in order to provide a large community-based testing campaign in the Mission. As part of this campaign, we found that while Latinos made up 44% of the people who were tested, they made up 95% of the people who ended up being diagnosed. We also found that 90% of the people who were diagnosed with COVID-19 could not work from home, suggesting that this disease is impacting communities that may be unable to work from home or have the resources to stay at home during our shelter-in-place order. So as part of these activities, it's really a reflection of what we're seeing citywide, and that we need to make sure that people who are at the greatest risk for COVID have the resources needed in order to take time off of work if necessary and if they're diagnosed or exposed to COVID.
I think, as we've seen in New York, density is a huge factor. So it makes sense there'd be quite a few cases in the Mission District.
Yeah, we did find that the median size of the households was greater than 3 in the majority of people who had been diagnosed with COVID. So this does go back to the fact that COVID is really most likely to transmit within households, and we need to make sure that households have the information that they need if somebody is diagnosed with COVID, and that they can appropriately clean their spaces, and that people can self-isolate and if necessary, that they have access to city-funded hotel rooms where they can safely isolate or quarantine for the appropriate amount of time and thereby reduce the risk of spreading COVID to others.
Just to confirm, these tests are completely free, right? What kind of turnaround do we have?
So fortunately, San Francisco offers free testing to all San Franciscans who have even one symptom consistent with COVID-19. What you need to know about this testing is that you have to schedule it online, but that you don't need any medical insurance and you don't need a doctor's note. In addition, testing is available to all San Franciscans regardless of immigration status. You'll be able to get your test results in just 1 to 5 days after getting a test. And you'll get follow-up through the health department if you are found to have COVID-19, including access to all of our tracing activities that I've talked about today. So if you're offered an opportunity to test for COVID, I recommend that you go for it, because it's important that we all really understand that testing is part of our new normal and a really important pillar for our fight against COVID transmission here in San Francisco.
Now, some countries have been responding differently to the virus. Some of them have been asking their citizens to keep a diary so they can remember who they've seen, while others are encouraging people to download an app to their phone that can help with contact tracing. Have we been thinking about any of these steps?
So a major part of our work in tracing is to really talk to somebody about where they've been and who they've been in contact with in the days prior to developing symptoms or on the date of their test, and if they do not have symptoms. This really requires jogging somebody's memory, and as we all know, it can be hard to recall exactly all the things that one has participated in days in the past several days. So we are recommending that everyone pay attention to what they're doing as we lift our shelter-in-place orders. And we are carefully looking at the possibility of apps being able to support us in being able to understand where someone may have been and who else may have been exposed to COVID. But as part of that, we're taking careful caution and doing our due diligence to ensure that people's privacy and confidentiality is maintained. This is the number one priority for us in the Department of Public Health. We want anything that we offer through an app to be supplementing as well as instead of replacing our current contact tracing effort.
So it seems like any app-based program the city might offer would be on a strictly opt-in basis.
Absolutely. We would want people to choose whether or not they want to participate in this type of app-based program, and it would be very much voluntary if they were diagnosed with COVID and they wanted to share information with the Department of Public Health or with others. We really want to make sure that any app that we recommend as a department is completely confidential and maintains the highest levels of privacy, and also is able to supplement our current offering of contact tracing and not become a distraction whereby people are getting notified but don't have context or information that they need in order to take the appropriate next steps.
Yeah, I think it would address people's concerns if it's strictly voluntary whether you use the app or not. So finally, what would you say to our residents is the best way to stay safe during this pandemic?
Well, I like to boil it down to a short little phrase: cover your face, test early, and trace. And by that, I mean that as we're lifting our shelter-in-place restrictions, we really want people to continue into their new normal life wearing a mask. We know that this is a very protective way of preventing the spread of COVID, and we want everyone to adopt this practice in their life as they move forward. We also want people to pay a lot of attention to their bodies as we begin to move back out into the world, and especially any symptoms that may be consistent with COVID-19. Fortunately, we have the testing resources here in San Francisco to ensure that every San Franciscan can access a test if they have symptoms. And so if somebody is experiencing any symptoms, we want them to seek out those testing services immediately and isolate until they know their results. And then finally, if somebody is diagnosed with COVID-19, we want to make sure that they have been paying attention to who they've been spending time with in the days prior to developing symptoms or the days prior to their test. So that includes an element of tracing your footsteps, as I like to say, and just being mindful of your interactions, particularly any interactions where you may have not been masked or have been spending time with people over 10 minutes and less than 6 feet apart. By keeping a sort of a log of the people who you may have been in close contact with, it'll be much easier if you are diagnosed with COVID-19 in order to work with the health department and reach out to those individuals to assure that they know that they were exposed to somebody with COVID-19 and that they can get the appropriate testing and quarantine so we can ongoingly reduce the risk of transmission to others.
That's really fantastic information, Dr. Sachdev. I really appreciate the time you've given us today. I know you're really busy.
Yeah, absolutely. And I hope to continue the conversation. Thanks.
Well, thanks again. That's it for this episode of Coping with COVID-19. We'll be back with more pandemic-related information shortly. For SFGovTV, I'm Chris Manners. Thanks for watching.